Hi everybody, Assalamu alaikum wa rahmatullahi wa barakatuh. I hope everybody is doing great and everybody is safe in this current pandemic crisis. And I hope everybody is fully equipped with the mental health as well as the physical health. I hope no one here needs the cognitive behavioral therapy. Well, I just used the name cognitive behavioral therapy. We all know that we are seeing the world economy is crumbling, world political scenario is crumbling, so are the humans. So whenever the human beings are struggling, it's evident that a struggling person is involved somehow in the mental disorders. And to eradicate, evaluate, and to elevate a person from the mental disorder, one needs psychotherapies. So there are so many mental disorders and so many psychotherapies, and here today we will try to analyze, we will try to discuss, and we will try to somehow evaluate the cognitive behavioral therapy. It's a psychotherapy for the mental disorders. And before we further proceed, and prior to the introductions of the cognitive behavioral therapy, I would like to highlight in brief what is a psychotherapy. And for that, I have to share my screen. And here I am sharing my screen. I will share the files, and from the file sections I will probably share the PPT here. So here I am sharing the screen. It's a unprecedented experience and it will take me some time. Here I am going to share my screen. I will share what I have to share. I have to share a screen. After sharing my screen, I will go to the D section and then I will move to the PPT sections. And once I'm in the PPT sections, I will have to show you a PPT that is the mental disorders. So in the initial moment of my presentation, I discussed it with you that I hope everybody is doing great and no one here needs the psychotherapy. One of the psychotherapy is cognitive behavioral therapy. So we will try to draw our attention to the cognitive behavioral therapy, that's also known as CBT. What actually is a psychotherapy? Prior to the start, prior to the introductions of a cognitive behavioral therapy, we would draw in general the our kind attention to the psychotherapy. So what is a psychotherapy? It's the treatment of mental disorder. Psychotherapy is actually a psychological problem, not a medical problem. We have to understand it. Medical problem is something else. Medical problems are those problems whereby one needs to operate, but mental disorders or mental problems or psychological problems are something else and something different from the mental disorders. Now, we just discussed that psychotherapy is the treatment of mental disorder by psychological rather than medical means. Now, what's a mental disorder? Actually, a mental disorder is a condition that affects our mood, our thinking, our behavior, how we behave in the society, how we behave in the family, our aggregate behavior. Whatever affects our aggregate behavior, we call it a mental disorder. Now, what is a psychological means that actually cures, that actually elevates a mental disordered person, or that actually eliminates a mental disorder in a person? A means, psychological means, is a means by which the mental cause, rather than a physical cause, that arises in the minds reflected to the mental and emotional state of mind. There are so many psychological therapies, and cognitive behavioral therapy, also known as CBT, is one among them, which we will highlight here. And it's sometimes a great treatment to such mental disorders that we already discussed in the mental disorder section of the presentation. But further afterwards, now what is the cognitive behavioral therapy? It's a common talk therapy. It means if a client is equipped with the mental disorder problems, he is supposed to consult a therapist or a psychotherapy, then thereon a conversation takes place between a client and a psychotherapist. And this conversation is known as counseling or the cognitive behavioral therapy. And it actually automatically at the end cures the mental disorder of a person. So in a cognitive behavioral therapy, one works with a mental health counselor, that is the psychotherapist or a therapist, in a structured, that is a systematic and organized way, attending a limited sessions, limited number of sessions. That means attending a limited number of conversations between a client and a psychotherapist. These sessions may vary from person to person, may vary from a mental disorder person to person, because it depends upon the capability, ability, attitude of a mental disorder person. Now, from now on, henceforth, we will use the CBT for cognitive behavioral therapy. So, CBT helps you actually become aware about inaccurate or negative thinking, so you can view the challenging situations more clearly and respond to them in a more effective way. CBT can be very helpful tool, either alone or in a combination with other therapies. For example, if someone is currently going through a mental currently going through a medical what we can say treatment, at the same time, if that person will go through the mental treatment, it is going to be effective. The research has that once a person is going through a medical or a physical treatment, and at the same time he or the same person goes through a mental treatment, it's evident, it has been observed that this treatment is going to be very effective at that time. So, but not everyone who benefits from the CBT, but not everyone who benefits from the CBT has a mental health condition. Sometimes once we feel that we are morally downgraded, in order to uplift oneself, morally, we need some sort of counseling, we need some sort of CBT, and at that time we consult either our elders or either the experienced person in our community. Now we can conclude in the introduction section that the CBT can be an effective tool to help anyone to learn how to better manage stressful life situations. Okay, now coming to the second part of our topic, that is the objectives of cognitive behavioral therapy. Cognitive behavioral therapy is used to treat a wide range of issues. We already spoke in the initial moment of our presentation that it actually treats the mental disorder, and we will further move towards what actually a mental disorder is, how actually it looks like, what actually a mental disordered person goes through in the mental disorder problems. We will further discuss them in the later part of our presentations. Uh, further we will discuss them, but at the moment we will try to highlight the basic objectives of a CBT, why a client is taking the CBT, why it is important to give him a CBT. So it generally requires fewer sessions than other types of therapy. We already discussed that there are so many psychotherapies for different psychological problems, and CBT is one among them. And the CBT, as far as the CBT is concerned, it requires fewer sessions than other types of psychotherapies. Why? Because CBT is a useful tool to address emotional challenge. For example, it may help us manage symptoms of mental illness if someone is feeling mentally ill, and the CBT is the correct answer to cope up with those mental illnesses. It actually helps us to prevent a relapse of mental illness symptoms. It treats a mental illness when medications are not good option. CBT is most appropriate and most beautiful when the medical help fails to achieve those predetermined aims or results that are supposed to achieve. Now, CBT also helps and helps us to learn techniques for coping with stressful life situations. We all know that everyone everyone. If we divide the society or the individuals in different classes, and for me, and I have seen and I have observed, and the different research suggests that everyone, be it the adults, be it the minors, be it the adults, be it the males, be it the females, be it the children, be it anyone, everyone at the moment is going through a stressful situation in his her life, and the CBT is the correct answer to learn about those techniques that are helpful within the stressful life situation to tackle them. It also helps us to manage and identify the ways to manage emotions. There are different emotions. One, a person develops a different emotions in different occasions, and it actually CBT helps us. It boosts us to develop and manage those different emotions and different occasions. Now, resolve relationship conflict, learn better ways to communicate. It also helps us to resolve those ways, to learn those ways that are better to communicate in different occasions. Again, it helps us to cope with the grief or loss. It helps to overcome the emotional trauma related to abuse or violence. We see that right from the 21st century, the 90s kids, be it the 90s kids or the 20s kids, everyone is a witness to the world violence, and everyone is going currently through the trauma that the violence had affected in our mind setups. And this CBT is actually the helping hand, bring to be a helping hand to cope and overcome those emotional trauma related to the abuse or violence. Now, we all must be going through the medical treatments, be it the headache, or be it the pain, be it the chest pain, or be it the waist pain, be it any kind of pain. Everyone is going somehow within their lives with the mental, or sorry, with the medical treatments. And once the medical treatments are proving to be disastrous, because we all know that the medical treatments are having the what we can say, medical treatments are having the side effects as well, and to cope up with those side effects, it's helpful. It actually helps us to manage the chronic physical symptoms. Further, the objectives of the cognitive behavioral therapies are: it helps us to develop mental health. It helps us to it helps us to cope with the mental health disorders that may prove and that may improve with CBT include. All right. So mental health disorders that may improve with CBT. So what we, in order to list those problems that may improve, in order to list those disorders that may improve with the consultations of the CBT, that's the cognitive behavioral therapy. Those disorders include, I already told in the initial moment of my PPT that we are going to discuss the problems as well, the disorders as well. What are the disorders? Actually, the man or the female, actually the man or the woman are facing in the mental disorders, and those problems, mental disorders that may at the same time improve with the consultations of the CBT are: those problems include depression. We all know that everyone, be it the small child, kid, or be it the adult person or the elder person, is having some sort of depression, and this CBT may improve the depression level of the person. Then we have the schizophrenia. Schizophrenia is actually the abnormal perception. One may claim that he or she has seen a ghost, or he has heard some sort of side talkings, or she can claim that that person has seen a sort of mummy or ghost, but actually that those things are not existing anywhere. So it's this abnormal perception is called schizophrenia, and CBT may improve the problems or the disorder of schizophrenia in a human being. We all have the anxiety disorders, like psychological disorders, like we have the different phobias. Currently, we have the new phobias, we have the writing phobias, we have the reading phobias, we have the plane spacing phobias, be it any kind of phobias. And the CBT is the correct answer to tackle those phobias. We have the PTSD, that we already discussed it. It's the post-traumatic stress disease, and CBT helps to improve that PTSD. And we have the sleep disorders. We wake up till to the late nights and wake up in the early morning, late in the early morning. So that's actually a problem as well. And this CBT can help us to tackle those problems. At the same time, it improves our eating disorder as well. In some cases, CBT is most effective when it is combined with other treatments, such as antidepressants or other medications that we already discussed. CBT generally focuses on specific problems using a goal-oriented approach. CBT is most effective when it is supposed to tackle any specific kind of problems. For example, if someone is encountered with a schizophrenia disorder or a depression disorder, and to apply the CBT on a particular problem, for example, to apply the CBT on specifically the mental depression problems or the mental depression disorders, it proves to be fruitful in that approach. To the next, what are the steps in CBT? CBT typically includes these steps. One, once the problem is identified, identify troubling situations or conditions in your life. CBT is applied once you are encountered with some sort of problems or the mental conditions or the mental disorders. Once you identify those troubling situations, then it becomes aware of your thoughts, emotions, and beliefs about these problems. Then you become aware of your thoughts. For example, if I encounter that I have a depression and my depression level is increasing, I become aware of my thoughts, emotions, and beliefs about these problems. That's the depression. This may include self-talk. I talk to myself. I interpret the meanings of a situation, belief, and the people, what they think about me, and the events that are going around me. Then I identify the negative or inaccurate thinking. This CBT actually helps us to identify negative or inaccurate thinking. You may be asked by a therapist to pay attention to your physical, emotional, and behavioral responses in different situations and reshape negative or inaccurate thinking. The next step in the CBT is it actually reshapes our negative thinking and inaccurate thinking and converts that negative or inaccurate thinking into positive thinking that is the helpful in our future endeavors. And then CBT is generally considered short-term therapy, ranging from about 5 to 20 sessions. You and your therapist can discuss how many sessions might be right for you. Based and depends on the types of disorders or situation, severity of your your symptoms, how long you have had your symptoms, or how when dealing with your situations, how quickly you make progress, and how much stress you are experiencing, how much support you receive from family members and other people. Going to the next part of our presentation, it is the conclusion of our PPT. So we can conclude and we can say that the cognitive behavioral therapy may not cure every condition, your conditions, or make an unpleasant situations go away, but it can give you the power to cope with your situation in a healthy way and to feel better about yourself and your life. Number two, CBT is not effective for everyone. We have to remember that it is not effective for everyone, but you can take steps to get the most out of your therapy and help make it a success. How? You have to be honest, you have to be dedicated to your problems, you have to be very honest to your physiotherapist. In nutshell and in general, you have to follow the guidelines and the suggestions that whatever is suggested you by your physiotherapist. Therapy is most effective when you are an active participant. That's what I was saying. And share in the decision making. Be open and honest. You have to be open, you have to be honest, you have to share whatever you feel, you have to share with your physiotherapist whatever you encounter in your life, and stick to your treatment plan. You have to stick to your treatment plan in order to make the CBT a successful endeavor. You have to follow the guidelines properly, whatever is suggested you by your physiotherapist. Then next, don't expect instant results. It's not a day in and day out process. It will take its time, and you have to be very calm, you have to be very composed, and don't expect the results within the minutes, don't expect the result within the nights. It will take its time, it will take its due time, and you have to be, during that tenure, you have to be very calm. Do your homework between sessions, do whatever is asked you to do between your sessions. That means from session 1 to session 2, if there is a gap of 2 to 3 of 10, whatever it is, the duration gap, you have to be very punctual during that gap. You have to follow your physiotherapist's advices, guidelines, and do your homework properly. If your therapist asks you to read, keep a journal, or to do other activities outside of your regular therapy sessions, follow through. Doing these homework assignments will help you apply what you have learned in the therapy sessions. If therapy is not helping, at the end, if therapy is not helping, talk to a therapist. Ask him that you are not improving, your condition is not improving, your condition is going from bad to worse day after day. If you don't feel that you are benefiting from CBT after several sessions, talk to your therapist about it. You and your therapist may decide to make some change or try a different approach. That's it. Thank you so much.